Welcome to Your Healthcare. I'm Dr. Lahav. It is springtime. Sneezing, coughing, touching everything on the subways, trains, buses, cars, shaking hands with people. What about allergies versus the common cold or the flu season? That's not over yet. There's a resurgence of all these pollens in the air, the coughing, the sneezing. How do you take control of it? What do you do to make you feel better? How do you know if it's an allergic reaction? Are you developing an allergic reaction to something in the environment or even possibly food or something to contact versus some of these colds that are around and still lingering around even after the winter? We will discuss this and much more today with Dr. Hafsa Nawaz, who will help us determine about different types of etiologies and reasons for allergies and treatments for common cold, flu, and even allergic reactions. I'm Dr. Lahav. This is Your Healthcare. Stay tuned, and we'll be talking about allergies and respiratory illnesses. Welcome back to the show, Your Healthcare. I'm Dr. Lahav, and today we'll talk about something that's present all around us. With the spring season coming around and in full vibrant of the summer right around the corner, we'll talk about allergies and some of the different symptoms that are around us every day. I want to really kind of give it a little bit overview between allergies versus some of the common cold and flu symptoms, which are still lingering around even after the winter. If we can go to the presentation, please. So allergies and respiratory illnesses. Anything from the upper extremity, actually upper respiratory tracts. We'll begin really with the allergies. Allergies are among the most common chronic conditions worldwide, not just in the United States. Allergy symptoms range from making you just miserable to putting you at risk for life-threatening reactions, what we call anaphylaxis. There are different types of allergic mediators, anything from plants to latex, as in the medical field, animal dander, jewelry, certain things like food, milk, medications, nuts, bees and wasps, pollen, dust, mold. All these things can cause an allergic reaction to different levels of a reaction. What are some allergy facts? Well, spring goes into full bloom, as I stated before, and you're in real misery. It's supposed to be really nice out. You're supposed to go out, but the grass is cut. The pollen is in the air. Certain individuals fight these type of allergic reactions with certain foods or chemicals, things that are topical, or some of these airborne particles. The big 8 allergens are soy, eggs, milk, fish, wheat, shellfish, tree nuts, and peanuts, just to name a few, but there are many, many more that are also present. Well, what happens with an allergic reaction? An allergic reaction begins in the immune system. Our immune system protects us from invading organisms that can cause illnesses, but an allergic reaction sometimes is an overreaction. If you have an allergy, your immune system mistakes an otherwise harmless substance as an invader. This substance is called an allergen. The immune system then overreacts to the allergen by producing what we call IgE. These are antibodies against this allergen. These antibodies travel to cells that release histamine and other chemicals, causing an allergic reaction. And there's different levels of how the allergy can affect you, between life-threatening to just making you somewhat more miserable. Some of the overview is that allergy symptoms include itchy eyes, itchy skin, sneezing, nasal congestion or runny nose, wheezing, and sometimes even a rash on your skin. There are seasonal allergies from grass, weeds, tree pollen, and molds, just to name a few. Cat and dog dander or other animals are also common for certain individuals. And of course, there's food allergies, which some of the big ones include things like peanuts or milk, for instance. Some of these can be actually airborne versus contact, which makes a difference regarding your risk. People with allergies can develop red, swollen, itchy eyes when exposed to their allergic mediator, respiratory difficulty, as well as GI difficulty or gastrointestinal difficulty regarding your stomach, for instance. If you've got allergies, you may wonder what to expect in the long term. Are you really stuck with this allergies for the rest of your life? If you don't have an allergy now, can you develop an allergy? And if you had an allergy before, can it get better? And these are some of the things I will speak with Dr. Nawaz, because it is important to figure out, really for your future, which way are you going with these allergies. Again, some of the symptoms: allergic reaction typically triggers the symptoms in your nose, lungs, throat, sinuses, ears, your stomach or skin, just to name a few. For some people, allergies can trigger symptoms of asthma, and we'll touch upon that as well, because that can be very serious. Most serious cases are life-threatening reactions, what I mentioned as anaphylaxis. And again, a number of different allergies, especially these days, again, include pollen, dust, food, different type of insect stings, especially now bees out in the spring weather, animal dander, mold, different type of medications you may be allergic to. One of the big ones is penicillin, and latex, especially in the medical field. There are even some physicians that become allergic or have a reaction to latex, as well as some individuals and patients. We'll cut across to the cold and flu overview, because sometimes they do go a little bit hand in hand, and you have to try to figure out which one you're having at the time. The common cold, including chest cold and head cold, and seasonal flu, are caused by viruses. So this is the difference here. Using over-the-counter cold medications to relieve some of the symptoms, such as sore throat, runny nose, congestion, and cough, some of the usual things that we do to try to really avoid seeing the doctor at the time. But you have to determine when is the right time to see your doctor or speak to your doctor. Flu symptoms are similar, but include fever, headache, and muscle soreness to a much higher level. And that is important, especially regarding different type of injections you can have to try to prevent the flu as opposed to a common cold, for instance. Well, what is a cold? Sore throat, runny nose, sneezing, coughing, we all had it. These are the hallmarks of just a common cold, and unfortunately hits millions of people in the United States each year. No matter what you do or how healthy you think you are, you're always at a risk for some of these things. Adults get an average of 2 to 3 colds per year, while kids get even more, especially at schools and daycares, and interactions with other public transportations can sometimes raise some of these risks. Although the common cold tends to hit in the winter and spring, it's possible to contact a cold any time of the year, including summer. The common cold is the result of rhinovirus. This is the type of virus which is the most commonly the one responsible for the common cold. It usually clears up on its own without really not much to do, just treating you symptomatically over a week or so. Now, what happened when you look at the common cold versus flu symptoms? On the common cold, you can have fever, but it tends to be low, and sometimes no fever. Maybe occasional headaches, stuffy or runny nose, some sneezing, a little bit of coughing or hacking, achiness or pain, which is maybe slight, like a muscular pain. Fatigue, you're a little tired, but you can still actually have a normal energy level, and the usual kind of sore throat. If you have flu, the fever is somewhat different. Fever can be high, constant headache, could be a clear nose, sometimes a runny nose. There could be sneezing or coughing. The aches and pains, especially back pain, for instance, is sometimes fairly severe. Fatigue and exhaustion are fairly common, and a sore throat can also be seen with the flu. There are some home remedies which we always tend to go to before we contact a doctor or think we can manage it ourselves. Anything like garlic, honey, lemon juice, milk, chicken soup. Some people use pepper, water, different types of tea, cinnamon, and other type of supplements, which can be always used and tried to relieve some of these symptoms or to lessen some of these symptoms. But the allergies can be very symptomatic, and we'll jump right into that with Dr. Nawaz.
Thank you.
Well, Dr. Nawaz, thank you very much for being here. I think you brought this topic to my attention, allergies and some of the colds, and it's spring season now. Pollen's in the air, people are sneezing, coughing, and sometimes you're not sure. I don't want to get too close to that individual because they may have a cold and I don't want to contact it, versus it's an allergic reaction, they're suffering from allergies, I'm not going to get it.
Yeah. Well, thank you for having me. Good morning. And yes, I chose this topic because I do have allergies. So I suffer from that for the last 5-6 years.
So not only the physician, but you're also the patient.
Yeah. And especially early in the morning, it's in spring, mostly I suffer. So that's why I chose this topic. Plus, it's a perfect season to talk about that. And as you know, it's a great presentation which you just had it done. You actually overview most of the things.
It's not as good as what you're going to enlighten us with, though. So
it's almost the same.
We'll talk about all these things together.
So, but you know that it's a very common thing. Close to 3 million people suffer allergies and common cold this time of the year, which is close to 30% of the population. So it's good to talk about that, and good to know is anything else we can do before taking medication.
Right, because antibiotics sometimes, if you overuse it and not use it for the right reasons, you can actually cause other problems later on.
Sure, it can be harmful rather than beneficial for you.
Absolutely.
And so allergies, just to be clarify, allergies we are talking here this time is more seasonal allergies and environmental allergies, which is also called hay fever or allergic rhinitis. There are other kind of allergies like drug allergies, penicillin. So that's different. So let's talk about the seasonal allergies first. Seasonal allergies, the most common is the tree pollens, which starts from late winter to early spring. And after that is grass pollen, which is, it can last the whole summer. And then ragweed, which starts end of summer and early fall. So some people have allergies in the fall, and they said there's no pollen. So it's a ragweed pollens, basically. Some people have allergies all year long, and those can be indoor allergies, which is dust mites, mold, to the pet's dander, so these kinds are indoor allergies, and those people have suffered all year long. So so it's very important to define and differentiate yourself that, when I get the symptoms, so what kind of allergies I have. So allergies are very self-diagnosed. Most of the people diagnose, that I have allergies because it happens at a certain time of the year. And when I'm exposed to certain animal or certain food. So it's most of the time self-diagnosed. Yes, doctor or the healthcare profession can help you a little bit to guide you, but I tell people, especially when they come for some kind of allergic reaction, it happened 2 times in my life. So I said, have a food diary, have some kind of event diary. What do you do that time and this time? Is there anything common? So be very careful and conscious about, what is causing your allergy symptoms. And symptoms are, as you mentioned, is sneezing, watery eyes, runny nose, congestion in the sinuses. And they are very overlapping with the cold symptoms. And only difference is cold usually caused by viruses, and it can last 7 to 10 days. But allergies, if it lasts more than that, then probably something more than cold. Cold shouldn't last more than 10 days. If with 2-3 weeks of this sneezing and watery eyes, then you don't need antibiotic for that. This is most likely allergens, invaders going inside your body, which is causing this inflammatory process and reaction.
So if you are feeling, let's say, overall, okay, you have a little bit of runny nose or runny eyes, for instance, and you say, well, I may have a little bit of a cold versus, I may have a little bit of an allergic reaction to something going on. If it really lasts in longer that kind of 7 to
Right.
10 days, then it's really not maybe a cold. Maybe you are having some reaction to something.
Right. I
And-
mean, there is some chronic sinusitis can develop, so chronic changes in your sinuses, and the people have that nasally voice and nasal congestion for long. Especially, it's more common in children. But usually, without any fever, having these upper respiratory symptoms during spring, fall, most likely is allergies.
So allergies in of themselves, you don't really have a fever associated
Most
with
of
it.
the time, no. Yeah. So again, allergy is an inflammatory response, and as you know that inflammatory response, fever is another inflammatory response. So it can, because people feel fatigued, tired. It's very miserable. Do you have allergies or no?
I actually don't know.
Yeah. So it's actually make you miserable, fatigued, tired, and especially when you take those medication to calm down your symptoms, they actually make you more sleepy and tired. So fever can happen low grade, but having 101 fever, this is not allergies.
So it's a really kind of a more of a low grade type of fever. Or
Right.
if it's really a high fever, something else is going on. Or maybe because you do have severe type of allergic reaction, maybe you did develop something else, you know,
Yeah,
pneumonia,
yeah.
especially if it's respiratory related.
Right, because your immune system is under attack, so other things can cause superimposed infection or infectious process.
And that now, we touch upon really kind of the respiratory seasonal type of allergies that are out there. And I want to sort of mention also, maybe jump a little bit into asthma on it, because that does make a little bit difference. So you're having an allergic reaction. Can it potentiate into something like asthmatic reaction?
Right.
Is there any correlation between the two
Of
for
course,
individuals,
yeah.
especially in kids also?
Yeah, hay fever and asthma trigger. People have asthma, but definitely it triggers during allergy season. Again, the invaders are there, pollens are there, allergens are there, and so difference with just upper respiratory in your sinuses and the nose allergies and asthma is wheezing. So if it goes all the way to your lung and cause wheezing, so you most likely trigger your asthma attack.
So
And-
allergy is more kind of an upper respiratory
Right.
maybe problem, but for asthma, it can actually go even deeper down into your
Right.
lungs where you have more difficulty
Most
breathing,
likely,
for
yeah.
instance.
Most likely, yeah. And I was wondering when, because I developed allergies later in my life. I never had allergy as a child. And so so especially, I see now the kids, when we were kids, there's no peanut allergy or this, this kind of allergy.
I agree, and that's actually a very interesting point.
Yeah.
You said actually you develop allergies. You're perfectly fine. How all of a sudden you develop allergy as you're getting older versus some people who had allergies maybe get better with
Right.
time. And then when we were kids,
Yeah.
we used to play around with it. I don't remember any other kid with peanut allergy or milk allergy or
Yeah, exactly.
other.
So the thing is, you are playing around. So that's the thing. So now we don't play around outside. We just play like this. We play mostly inside. We are too clean. And I know as a doctor I shouldn't say that, but after 1970s, these allergies became more common. And some things have changed. The first thing is the climate change, and it's real. The climate change is real. So what does the climate change mean? That the seasons prolonged. Winter, it's not like from December to February is a winter period, and after that March to May is a spring. No, you know that. You saw that. Winter is just linger on, and we're just, before the show started, we started talking about spring. One day is this temperature, one is that. Spring is prolonged. So when the season is prolonged due to the climate change, more pollens and more allergens are there. And second thing is, of course, air pollution. So we are more populated now, more cars, more factories, more fumes. And so air is more polluted after 70. 70 kids are more polluted before than it was more trees than the machines.
So do you see any difference between those are in the urban setting versus
Yes.
suburban
Yeah.
setting, for instance?
Yes, I-
People are, or the kids out on the farms, for instance, or upstate versus in Connecticut area, New Haven, New York, things like that.
Right, so congested areas, more factories are more developed areas. Somehow allergies are more common. People live in small apartments, big, high, tall buildings. Yes, allergies are more common there. Those are indoor allergies. And third thing I want to mention, that use of formaldehyde. you know that as a physician, formaldehyde was used to preserve the bodies when we did the anatomy dissection and everything.
Yes, back in medical school.
Yeah, so you still remember, that's good. So that formaldehyde actually preserved, so it's used in preservatives so many ways. Ceilings, insulation, plywood, you know, where you live, in your apartment and the house, the formaldehyde is around. Lots of household products, for example, soaps, lotions, baby wipes even, toothpaste, they have formaldehyde. Again, if you look back, it's not going to say, hey, you are using formaldehyde. It's a different forms, but it's a great preservative. And higher concentration of formaldehyde is carcinogenic for a human being, but a very low concentration is used to preserve, to increase the shelf life of these products. And that, you know, do you remember if you go to a new apartment with the new carpeting and you start getting watery eyes and sneezy, you know, itchy?
Yeah, it's a sort of stronger smell or aroma.
So that's formaldehyde gas. And so that's also increased after 1970s. That the preservative was increased to increase this, to make things more beautiful and preserved and make increased shelf life. So that's also increased the inflammatory response in our bodies.
So is that why there's also a trend to kind of look more towards moving to organic versus, the non-organic essentially?
Yes. And fourth thing I want to talk about is too much of antibacterial. We became more antibacterial.
Yeah.
You know that our body relies on the invaders. If you don't expose my body to good and bad bacteria, my body does not know the difference of good and bad. So we always give a good bacteria. We always, wiping everything and cleaning everything. So the small kid, they never develop the immunity against bad things. So when you grow older, then, you develop allergies. So, too much of antibacterial happens recently. It's not, it's not like started in 50s or 40s. It was good in a way. We, medicine advanced and we stopped so many bad diseases. But yes, we increase allergies by doing that too.
So it could be that we kind of moved the spectrum the other way,
right,
where we became so hygienic and so clean. Because, when I was a kid, I remember, I was crawling on the ground. I was, playing in dirt and sand and something you taste a little piece of, leaf that you found. You thought it looked good. Yeah. And these days, you're right. The kids are not as much outside, especially in these areas here. A lot of video games. Everything is using, these type of alcohol-based formulations to kind of keep clean your hand.
And it does absorb. So when we use those, antibacterial soap, or it does, although it looks like it's just on the hand, but it does absorb through our skin, and that changes the microbiome. Microbiome is microbes, bacteria in our body. It changes it. It tells us, this is bad. Only the good we know. The bad, our body forgot to know which one is bad. So fight against bad is decreased.
So the lack of exposure really can raise the risk of you developing some reaction to some of these things even later in life if you're exposed to them at some level. So even if you look really at the United States versus, let's say, Europe or Africa or Asia. I just feel like there's more, especially kids, with allergies in the United States these years compared to elsewhere in the world. And I think maybe that is a right pathway, that everything has to be cleaned and hygienic and alcohol-based compound and formaldehyde and preservation, that, maybe we're not exposed to these things anymore. Maybe we should go outside and dig our hands in the dirt a little bit.
Eat a little dirt. Or maybe we should change the 5-second rule to 5 minutes rule.
Right, let it fall on the ground and watch it for a little while, pick it up and you can eat it.
Yeah, I guess so.
A lot of these also type of, foods that are out there that are, with more preservatives. It's not really the natural food anymore. It's been changed. Yeah. And, even again, when I was a kid, everything used to buy and kind of make.
Right.
Now you take it out of the freezer and put it in the,
That's true.
you know, in the
That's true.
microwave.
Not much natural, yeah, more processed food, yeah. And so these are the different, I think these are the different causes why we have more allergies. So before, that's why when people ask, you know, what should I do for the allergy season? So rather than, yes, you know, it's the severe symptoms, as I told you, it makes you miserable. So you can take medication, but I always step back a little bit. Let's see what caused the problem, and let's see what else we can do to help alleviate some of those symptoms or calm down some of them, so we can take less medication if we have to. So, you know, not to eat dirt, but you should, first thing is knowing that these are my symptoms and these are the months or the weeks I will get the allergies. So don't start right there when you start having the symptoms. You know that I get allergies exactly end of April or May. So for me, some preventive measures I should do end of March or early April, not at that time when the allergy starts. So some of the measures are, there are some proven, some studies have done to take in, for example, vitamin D. Vitamin D has anti-inflammatory properties, and one studies have shown if you're people who have vitamin D level less than 30, those people have more prone to more allergies as compared to the people who have higher vitamin D level.
Really?
So you can take, you know, ask your doctor first what your levels are, and if you're less than 30, you can take 1,000 international units. It's a small capsule once a day for 3 weeks, and that actually help to increase some of the, to decrease some of the inflammatory process caused by the invaders, which is called allergens.
Can you use different foods that have vitamin D? You know, some fortified milk or orange juice or other multivitamins, for instance?
Yes.
Or vitamin D vitamin?
Yeah, so it's a vitamin D. So multivitamin has vitamin D in it, but taking a separate vitamin D, it has higher concentration. That's why, and the study which I'm talking about, they only use the vitamin D. That's why I'm talking about that study. And second thing is taking some probiotics. It's also help. So you know that if you have symptoms in April or May, start in February. Taking 6 to 8 weeks of probiotics also help, because what's probiotic is a good bacteria. So your body needs good bacteria to fight with those bad invaders. So that's also another study done. Can take some probiotics for 4 to 6 weeks, and that will also reduce your immune.
So the probiotic essentially keeps your gastrointestinal tracts, your stomach and your
More
intestines
healthier.
sort of healthier.
Yeah, right, right. Vitamin D, taking probiotics. These are all natural things. You can get it from any natural health food stores. And other thing was very interesting to me. There was a NASA study done, NASA scientists who did the study on the plant. There are some plants which actually absorb the dangerous gas of the formaldehyde, which we just talked about, which is in the carpet. Because I mean, if you live at your own home, you have ability to, oh, I'm allergic to the carpets, and I can remove and put a nice hardwood floor on. But lots of people live in apartment buildings. Changing any structure in the apartment building is not, you cannot do it. It's by the landlord, and so I had patients like that. So I always think what you can do, because they have to live there. That's apartment he got. It's a new carpet, but he's always come with runny nose, and eyes are always itchy. So I was looking at that. So there's a study done by the NASA scientists about the indoor plants, because they needed those plants to purify the air. There's 6 plants, 4 I remember. So there's a lady palm, bamboo palm, a rubber plant, and peace lily. There are 4 plants. They have a natural ability to absorb the dangerous gases of formaldehyde and purify the air. And but it's not like one plant for the whole building. You need to have every 100 square every 100 square feet, 1 plant. And hopefully that will help to absorb some of those gas and the chemicals and reduce your symptoms.
And these are plants you can find in the regular
these are very
store?
Very common indoor plants, yes. Yeah.
Wow, that's actually very interesting. 'Cause
Yeah.
besides giving you back the oxygen, the plants actually can absorb some of the formaldehyde.
Right.
And all these things you want to really try to work on before you're developing sort of the seasonal allergies that you normally do.
Right, exactly, yeah. So you can...
So be preventive, essentially.
Right. I mean, these plants can stay for years, you know, if you can take good care of it.
If you have a green thumb.
If you have water them, so they can take care, you know, stay at your home for a while, and especially in the winter and when the allergies, those season comes, so they will help you and purify your air.
I mean, that's great information from, you know, from vitamin D to probiotics to different plants that are, you know, things you can just do on your own.
Right.
Really could make a big difference, especially in an apartment building. If they're not that big, you need, you know,
Sure.
2 plants and you should be good.
Yeah.
You know, I want to go back really to the point that you said, you know, initially you didn't have allergies and you developed it later on. And there are some individuals who may have had allergies in the past, and then it kind of gets better with age. So it's not that you're particularly immune to not developing allergies,
Right.
correct? I mean, you're always prone that something can happen. You know, how do you know, again, if something's going to happen or not, or if you had it before, can it get better? Is there some, beside what you described there, can it just naturally, your immune response will improve just with age?
It does. So as long as there is no, seasonal allergies are it's a mild type of allergic reaction. There are some allergic reaction like from the drugs, like penicillin, as we talked about, or allergic reaction to certain chemicals. People have a hair dye and have a bad rash. So those reactions can be dangerous. But seasonal allergies are very mild because they come and go, come and go. So body is a very sophisticated system that body produce. That's called natural slow desensitization. Because if you live in the same city or the same environment for a while, and the body knows, oh, again it's the spring, right? So first time it produces, boom, so much, you know, army in the body to fight with those invaders. But slowly, you know, next year it will be less and less and less. Yes, it's not like you completely cure with that, because the body always remembers those bad proteins, bad invaders, as a bad bacteria, the bad invaders. But yes, to answer your question, yes, your response decreases with age, with time.
So there is an opportunity to actually get better, or actually maybe even if somebody moves, you move from an urban type of place to maybe a more suburban place, or moving from the east to the west coast or south. You can notice that you don't really have the symptoms anymore.
You know, the best treatment for allergy is to get rid of the invader. Okay, so yes, if you move and if those special tree pollens which you are allergic to are not there, yes, the symptoms will be less. But it's hard, because if some people are allergic to grass pollens, it's so hard. We go live in a desert.
Live in the desert.
So, yeah. So it's but yes, it's it's a common sense that it can get better. I remember allergy season. I have to go to California, so I was so happy in May. I have to fly to California. I said, you know, God, yeah, good. Actually, the 2 weeks my allergies will be better. Worse. It was so. I said, what's going on here? But actually, maybe the thing the pollens which I was allergic to here, it's also after 6-hour flight. It was there too. So, you know, if you really move, think about what you're allergic to and where you're moving. Not just because there's more sun and tree looks different, and it will be different.
So first go there, check it out, before you move your whole
move.
family to that location.
Yeah.
You know, and then when you can get kind of severe, what we call kind of anaphylaxis reaction, that's not really what you see with sort of seasonal allergies, correct?
Right. Yes.
Or can it happen if you're very susceptible to it? Well,
that's good you asked that question. Seasonal, very special seasonal allergies to tree pollens, and scientifically, ideally, you shouldn't have anaphylactic reaction, okay? But you know, ragweed, these invaders which we keep talking about, they have a protein. Body recognize them as a protein, the shape of the protein. For example, ragweed, my body recognizes as a triangle. There are some food apple, carrots, peanuts, almonds, they have the same kind of protein which is in the ragweed. And during this time of the year, one of the kids ate the apple, and boom, it's a bad reaction to the body. It's a rash and wheezing, and because he literally ate apple and he got that reaction. Body recognize the protein of the apple exactly as the protein of the ragweed. So body thought maybe it's a ragweed, and it's too much amount of ragweed you ingested. So that can cause anaphylactic reaction. So sometimes it's tricky. Sometimes it's not really the apple you are allergic to. It's not about the peanuts you are allergic to. Maybe it's and that mother will not give him apple again, because what she saw, the whole anaphylactic reaction, is because of the apple, but happened in this time of the year when those pollens were also there. So to answer your question, not really the allergens, environmental allergens can cause anaphylactic reaction, but the cross-reactivity with other products, yes, it can happen. And to prevent that, sometimes if you cook the protein, you can break down the protein particle, so body can recognize it's a triangle now, or peeling can help. Apple. Okay. And if you really want to know that it's because of the apple or the ragweed or this really peanut allergy, then there's a testing available, patch tests. With the allergists, you can do the testing too. But just by having ingesting something once or twice and have reaction, it could be something different too.
And since you mentioned the foods, for instance, peanut allergy is very sort of common, and some of these allergies actually are airborne. Yeah. If you're sitting there and I'm eating a peanut butter sandwich, I mean, you can get a reaction which could be fairly severe, versus something like a soy or milk allergy that it has to touch your skin in order to kind of form that reaction. And there are a lot of kids out there now with all these, to seeds, different type of strawberries and fruits and nuts and milk and all these type of allergens that are out there, and it makes it sort of a little bit worrisome. What do you do? How do you handle it? And what about exposure? There is some different, thought processes now, even from, physicians who specialize in allergies, really to keep them away completely from these type of allergen, or to actually expose them just a little bit at a time, so your body does get a little bit used to it and not have such severe reaction. And what are your thoughts about, that at this stage? Of our world?
It's hard. Both answers are right. Yes, the best answer to avoid from the allergies is don't have that invader, don't take that thing, don't be exposed to that environment. Sometimes it's hard not to. Sometimes, it's not only because it affects socially, because those kids are socially, everybody's eating pizza and carrots and in the party, and you are eating a separate lunch box so it's socially, it makes you different. You feel different, and as an adult, of course, I can understand there's a consequences if I eat, but the kids don't know the consequence, why I cannot eat that. And so socially it's impact too. So personally, I like to have this slow desensitization, that's slowly exposed. Some people will not get benefit from that if they really have bad allergies, and so that will be very minimal number of the population. But most of the people can get better with the slow desensitization. It comes in injection forms. You can have, your allergist, allergy special doctor can give you injection weekly and monthly, slowly against of that product, so that your body will know, rather than having a big amount to ingest slowly, and the body will produce enough inflammatory response to fight with that allergens. So, there are some kids who had very bad reaction when they were 3, 4, 5 years old, especially when they start kindergarten, bad reaction. Up till 4th and 5th graders, they are okay.
And then they can actually improve on some of those.
Improved just by the natural desensitization, just by the natural having, too much the body, knows enough is enough, right? And or just by these slow desensitization injections and the medications, they improve. Kids improve. Not all, but yes, there's hope.
And if you do know the type of foods, you can maybe cook them first and try to denature some of it?
Right, right. You can, if by cooking or by peeling, you can degrade the protein, and that can help. I mean, I don't know how to cook strawberry though, but you know, some things you can cook. For example, peanuts. You know, crush them and roast them. That can help. But you know, you can live without peanuts too, right? So,
True. Especially today. I mean, everything has
right.
labels on it.
Yes, yes.
So you
and
can find out.
That's good, yeah. And other thing was also for my kid. Actually, not my kids have allergy, but my neighbor kid had allergy. So having a broccoli sprouts, they have when we ingest in the body produce response, which anti-inflammatory response, same as vitamin D or same as probiotic. So broccoli sprouts were also studied that if you consume 100 to 200 grams every day only for 4 days, that help. And in that study, very small study though, but those patients were exposed to the diesel fumes, and so their response to the allergies were way less as compared to the patients who did not have broccoli sprouts for 4 days.
And 100 to 200 grams of broccoli, how much is that about?
How much? Actually, they crush it. The broccoli sprout is hard to eat, the small one, so you crush in a food processor. You can sprinkle over. It's this much. It's
it's like a fist.
Yeah, and you can sprinkle over your salad or hide under your kids' whatever the sandwich. That's why they don't eat broccoli. And
broccoli, that's great.
Yeah, and over the soup you can sprinkle. That's also have anti-inflammatory response. And don't use too much antibacterial soap. I mean, soap is good. Water is the perfect. You know, you have a dirt hand, wash with the water. I work with a dermatologist actually, and you know, dermatologist, skin doctors. So they see lots of patients with lots of skin problems, open skin, rash, blood coming out, and he was always touching the patients, and then wash hands with the cold water, and go to the next one. And when you're a medical student, you know, every rash, I'm like, I'm not going to touch that, right? Right? So, and I'm cleaning my hands. So, and he's senior skin. So he said, why you keep washing your hands all the time? So it's not every rash, everything is contagious. And why he does not get sick always, just because his body is slowly immune to so many things. Same as like a doctor's. Lots of patients come and ask me, oh, you know, I'm coughing because my son was sick and my coworker was sick, and now I get infection. And they ask me, why don't you get sick? Because you see every day so many sick people, right? So what's the answer for that? I don't know the answer. Answer is probably, I'm the same person. I don't take anything extra to protect I don't take antibiotics to protect my system. I think it's a slow desensitization.
Or exposure.
Exposure, yeah. So exposure, we exposed to so much. So don't be shy of being exposed to, you know, some non-antibacterial things.
Well, those are some great points from Dr. Nawaz here, really touching about the allergy and some of really homeopathic type of treatment you could do to try to decrease some of these symptoms. This is Your Healthcare. I'm Dr. Amit Lahav, but stay tuned. We'll be right back, talk about some more upper respiratory illness. We'll be right back.
My hair, I was sitting in a barber's chair, just gonna run away from here. Don't you push on my head. I wish that I was dead, but I was stuck in a slicker chair. Well, I just swore when I was old enough, and I'm from my own way out the tub. I let my hair go down to the floor. Gonna leave this town and coming back no more. I won't be sitting in a barber's chair.
Welcome back to Your Healthcare. I'm Dr. Amit Lahav, and we're here with Dr. Hafsa Nawaz discussing allergies and some really important messages that have come across to you as the audience to make you better and maybe decrease some of those seasonal allergies that you have. Perhaps a different thing you can do around your house to make it better. We're going to jump a little bit now into a little bit of the cold and flu season. You know, the winter is that's where we're getting immunization and some of these shots I mentioned before against sometimes the flu, but it doesn't cover everything. And how do you know when you need to see the doctor regarding a cold versus flu versus sometimes even increasing to something like pneumonia, which you do need treatment, especially in the elderly. So Dr. Nawaz, thank you again very much for being here. You know, everything you spoke about allergies was very informative. And I think we all appreciate all this information.
Sure. Thank you.
Let's go a little bit into, let's say, the flu and cold. You know, we spoke about the cold, 7 to 10 days, common cold sort of symptoms. But what about the flu? You know, immunization for the flu. How do you treat it? There's a lot of things over the counter that you can use. You know, what do you generally suggest? Because you see it all the time in your office.
Right. So first thing is get your flu shot. That's the moral of the discussion.
So you hear that? Get your flu shot. Get your flu shot.
Yeah, flu shot is, you should get it from October till January. You still can get in January. So flu is a deadly disease. Allergy won't kill you unless you have real anaphylactic reaction. Very, very rare. The flu still is a very serious sickness, and it can not only yes, in elderly people it can hospitalize you. In younger people, the working people, you have 3 to 5 days of missed work, and yes, younger people can be that sick, that dehydrated, that you have to admit them in a hospital too. So flu is a really you know, and a serious illness, and it's every year. It's still the flu virus is so crazy and so smart. It changes its shape every year, so we have to make a new vaccine to immunize ourselves every single year. I wish it's the same virus and we can eradicate like polio or tetanus or other things, one immunization in your lifetime and it's done, but it's not. It has to be every year. Because it changes its shape every year.
But every year, really, the immunization you get is based on the strains that were the previous year.
I know,
correct?
I know. Because, yeah, what you can you have to mix a little bit, you know, just try to go ahead a little bit of that virus, but it still changes. So this year, almost flu season is gone, but yes, in February and March, it was very high season, and still people say, oh, I had a flu shot and I get sick. Still, 80% of the people who had the flu did not have the flu shot. And so, you know, after getting a flu shot, so you still can get flu, but it won't be that bad enough or severe enough to put you in a hospital, or you have to have 3-4 days off from your work. So flu is basically high fever and fatigue. There's no other focused symptoms. Yes, you can have upper respiratory symptoms, just a cough, or maybe just a runny nose. But these, sometimes they don't even have that symptom. It's just young, healthy person now can't even walk to the bathroom. So flu can, you know, make you that sick and that tired and high fever. And medication works, but it's very tricky. Medication for the flu, antiviral, work only within 24 to 48 hours. But remember, in those 24, 48 hours, patient is so sick, can't even reach to the doctor. And when they come to the doctor, it's already 3 days over. So basically, medication doesn't work if you survive up till 3 days. So medication doesn't work. So that's why the flu shot prevention is very good for.
So it's only the very beginning. Once you're really beginning to be sick, that's when medications may potentially help.
Yeah.
But you know how we usually are. We say, we're going to get through this. We'll be okay.
Right.
And then it's 3-4 days later, which you're struggling, and at that point, it's too late to have any type of medication. And
on top of it, first 2 days is just flu makes you so bedbound. You can't even reach to the doctors most of the time, and it's very contagious. Flu is very contagious to your household, and at your workplace. And if I had flu today and I'm sitting talking, it's airborne, and you can have symptoms 2 weeks later. So it's not like I just had a symptom today, and it's very contagious. So that's why immunization for the flu will work only if we have maximized this immunization. Because if you still have some people left, they can infect most of the population. So
because those again are the newer strains,
right.
But if you decrease some of those symptoms with the vaccine, it's actually can eliminate a lot of these other cases.
Yes.
Being really people being exposed.
Right. And other thing is after when you have flu and your body is so immunocompromised at that time, your body is so down, then very common having a superimposed infection that you're talking about pneumonia. So people can get pneumonia on top of it. Remember, flu is a virus, and viral pneumonia also come just with fever and the cough. But sometimes you can get bacterial pneumonia too, and that's very worrisome. That's very severe. And if it affects elderly population, it takes days and sometimes weeks to really get better.
And that's when you have to now talk about some antibiotics.
Then antibiotics come, yeah.
Right, because that's such very different. Not every type of cold you need antibiotics.
No,
because that can develop some resistance, and you really can change even the flora of your bowel, which can lead to other issues down the line if you're just taking antibiotics.
Right. So exactly as we talked about, we are talking about the allergies. We're using too much antibacterial soaps and the wipes. That makes us more allergy to other things. So antibiotics are also same antibacterial things. So if we ingest too much of antibiotics, that also make us more prone to other things, because we kill lots of good bacteria which we needed, which our body needs to fight against most of the invaders.
And then just as a last point for the flu, for instance, you could be contagious not only when you get sick, it's also the time before you're actually sick.
Right, yeah, that's true. And that's where, most of the people infect others, because your symptoms are still not there, you're just feeling a little tired, and mostly people say, oh, I'm overworked or tired, right? We all are, right?
All overworked.
So, and that's a time when you can really start infecting other people too. And the fever, most of the people start staying home when it's a fever and it's really, really body aches. But just remember, if you are in a flu season and if you have a low-grade fever, it's better to stay home. Better to stay out from the public if you did not have a flu shot. And
as a last point, does your family have to do anything if you're diagnosed with flu? Should they kind of stay away?
Well, you cannot isolate that person. Is not that contagious unless you don't have to sip from the same cup or eat with the same thing. But otherwise, 2-3 days when the fever is over 100 or 101, then you're contagious. You have to stay a little away. But otherwise, it's not like if somebody in a household has flu that everybody should be treated.
Okay.
That in household in your own home where you have healthy people, no, it's not recommended.
All right. Well, thank you very much, Dr. Nawaz. We're going to take a short break, and we'll come back just to recap today's show about allergies and upper respiratory illness. Stay tuned. Welcome back for the finale of our show here on allergies and upper respiratory illnesses. We had Dr. Hafsa Nawaz with us here, who really enlightened us with all her knowledge about really some of the seasonal type of allergies, different things we can do about them, even on your own. if you listen to the rest of the show, there's some things you could really do at your own house to make you better, maybe decrease some of these seasonal allergies ahead of time so you can enjoy the spring and summer months. We also touch about the common cold and the flu, and the take-home point for that is get your immunization. It's very important, not just for you, but for those around you. I am Dr. Amit Lahav. Thank you for watching Your Healthcare. And once again, I would like to thank Dr. Hafsa Nawaz for being with us here today. We'll see you next time.